and operation and palpitation of heart, especially aggravation when thinking of his symptom, also when spoken to of his loss. If anyone telling about or discussing about the grief or about the loss which has been taken place to that particular patient, it will aggravate his suffering. And whenever anyone causing any diversion during conversation about grief, then he or she will feel better. Another point is already I have told complaints from exciting or bad news, sudden emotions, anticipation of any unusual ordeal. Regarding that, I am happy to share a beautiful case treated by me about 26 years ago. One lady is at about 52 or 55 like that. She was suffering from aplastic anemia and she was admitted in Commando Hospital, Kolkata. And in their own house, actually, her daughter was staying, and the husband and son of this particular patient was visiting particular patient in that hospital, and the daughter was waiting for the news whether her mother was doing good or bad like thing. Suddenly, he get she get a phone call from Command Hospital. Meanwhile, the husband and son of that patient could not arrive in the hospital, and daughter was waiting alone in the home. Suddenly, she took the call, and from another end, from the hospital end, one of the sister nurse communicated the death news of her mother. Just getting the phone call, she fell down on the floor, and the attendant, maid servant, she was doing work in another room, getting the sound of falling down. She came, and after few minutes, it was okay. Consciousness returns. But since that girl was suffering from severe trembling of hands whenever she tried to hold anything, especially cup of tea or glass, anything, hardly she could hold it. And that was the cause and effect of the cause. She received an exciting, sudden bad news, following which she was unconscious for a few minutes. Since then, she was suffering from trembling of hands whenever she tried to hold anything. Just considering this totality, cause, aggravation or elements from exciting bad news, sudden emotions, and the effect of the cause, trembling, motor paralytic weakness of the hands. She could not hold the thing. We prescribed Gelsemium 200, 1 globules in half cup of water in plus method. She was supposed to take 1 teaspoonful of mixed water of that medicine, 1 globules were mixed within 30 minutes interval. And with utter surprise, within 12 hours, she was started to improve. And whenever she visited me after 10 or 15 days, she was devoid of all symptoms. Not only she recovered from the trembling of the hands, but her general demeanor, the facial expression, the sadness, the melancholic attitude was also recovered with the fine pills, 1 pill of gelsemium 215 number globules. Then general depression from heat of sun or summer, another important thing. Whenever patient is getting heat in summer, after getting heat of summer, one may suffer from headache, one may suffer from diarrhea. There are lots of physical symptoms we get in our Mitra Medica. But after getting sun heat, if anyone is being very much depressed, especially regarding disposition of mind, Gelsemium would be considered a very good remedy. Getting heat of sun or summer, if anyone having very strong physical depression, rather prostration and weakness, in that case, Gelsemium will not be considered as a good remedy. Vinca minor would be the very good choice. Bad effects from suddenly hearing bad news, from fright, and it may result diarrhea, abortion, etc. Mental exertion causes sense of helplessness from brain weakness. Anyone is compelled to study, but not getting the thing or corroborating the thing in the brain, especially before exam period. Generally, we are giving the nomenclature of brain fag like that. As examination is going on, students are compelled to study and causing more and more mental exertion, ultimately may develop a helplessness of brain, that is the brain fag. Weakness, inability to attain anything, and recurring thought. And whenever they are attending in examination hall, they may also suffer from severe trembling. They may also suffer from sudden fainting, and after that prostration and weakness. After mental exertion in Gelsemium. Great irritability, does not wish to be spoken to. Mind it. Great irritability, but does not wish to speak, does not wish to be spoken to. The magnitude of irritability is so high.
मॅडम हे मोठं कसं करायचं मला
Desire to be quiet, to be let alone.
विश्वासच दिसतोय.
Does not wish to speak or have anyone near her, even if the person be silent.
होतं त्याचं मगाशी दिसत होतं.
So the irritability is so much, but not expressing in physical phenomena. They are holding all the irritability inner side of the mind. Looks like they are very calm and quiet.
नाही येत आहे ते तुमच्यावर आहे.
Please mute the participants. They're so irritable. Apparently it looks they are very much quiet, but internally very irritable. Does not wish to speak, does not wish to be spoken to. Not that. Even if anyone is present in that room and silent, but that may not be allowed by Gelsemium patient in extreme cases. Another important feature is dullness. Dullness of all the mental faculties. They could not comprehend, they could not retrieve, they could not think anything, confused and giddy, apathetic about his or her own illness. In extreme cases, regarding despondency, inner irritability is so high, and they become very much isolated socially, then the suicidal tendency may come. With inclination to throw oneself from a height, very much depressed. Children are having fear of falling, grab the nurse or crib like borax. Now I am sharing a few manifestations in physical genres. Why actually I am presenting in this manner? Whenever we are taking the cases in our OPD, in our hospitals, or in our own clinic, we are framing the totality. Apart from particular symptoms, grossly it depends on physical generalities and disposition of mind. So, if we learn anything, if we have any perception about any homeopathic medicine, first of all, we should comprehend the mindset of the patient, that is the disposition of mind and physical generals. There are lots of particular symptoms we may get in different source books. In Allen's keynote, it is 2.5 pages, but in Herring's guiding symptom, it is more than 30 pages. There are lots of particular symptoms we will get in different mathematical books. But the mindset, the disposition of mind, and physical generals, if we know correctly, we may prescribe the medicine on the basis of true totality. And invariably, after curing the case, if we retrospect the particular symptom in any source book, we will be astonished to see what symptom we do not know actually whenever we are prescribed the particular symptoms. But the patient has covered both the physical and mental generals and is being cured. Also covered the particular symptom written in source books. Now regarding physical generals, appetite, poor appetite in selected patients. Another group is increased appetite. Another group is easily satisfied with small quantities of food. It may appear to you people whether it is contradictory in Gelsemium patient, poor appetite and increased appetite. No, it is not the contradictory symptom. Whenever the compilation has been made for Gelsemium, few prover develops poor appetite, few prover develop increased appetite, a few develop satisfied with small quantities of food. The author has compelled to compile all those symptoms, but it is not like contradictory symptom of ignatia. Regarding intolerance, intolerance from wine. Thirst. Thirst is very poor. Thirst but does not drink much. It has to swallow in prodromal stage of intermittent fever. Tendency, little appetite and thirst but can take food or drink. If we ask the patient, what about your appetite? They will say, poor, it is poor, not so good. What about your thirst? Almost no thirst. But if the attendant of that patient offer food to Gelsemium patient, he or she could take it. Offer food or drink, he or she could take it. Now I am telling about some subjective feeling. Not, it is also a generalized feeling. Patient himself observe and tell us, which will also help the prescribing indication of any medicine whenever we are prescribing. Particularly for Gelsemium, it is aching, tired, heavy, weak, and sore subjective sensation. There are 4 terms actually. Aching in relation with pain, tired is a general feeling, heaviness is a sensation, weakness is a general feeling, with soreness. In almost all complaint, Gelsemium patient having head feels light and large with vertigo, lightness of head. Generally, patients, those who are suffering from vertigo, those who are suffering from fever, they're suffering from heaviness in head with vertigo. But in Gelsemium, we are getting lightness of head with vertigo, along with dimness of vision. Especially, it aggravates when suddenly move of head and working. Sometimes we may be confused with bryonia regarding aggravation of motion. of Gelsemium, which is very much similar to Bryonia also. But Bryonia having uncommon, peculiar, characteristic thirst for large quantities of cold water in a long interval. And Gelsemium patient, generally they are thirstless. Another group of Gelsemium patient, they may suffer from heaviness of the head associated with dullness of mind, sometimes dimness of sight and vertigo. And that ameliorates after profuse emission of watery urine. From students' life, repeatedly you have been asked in our exam, state one concomitant symptom. What is concomitant symptom? Give an example. And almost all of us, given the example of Gelsemium, headache relieved by urination. But the actual symptom is not only headache, vertigo, along with dullness of the mind, ameliorated after profuse emission of watery urine. In this connection, I would like to say another important homeopathic medicine having symptom almost looks like similar, but not at all similar. Whenever they are holding their urine for any circumstances, after holding urine for a long time, they are feeling bad in head, sometimes may suffer from headache. In Gelsemium, we are getting headache relieved after profuse emission of watery urine. In that medicine, it is not the reverse symptom. If patient do not hold the urine, there will be no headache. After holding urine for a few minutes or few hours, they may suffer from headache, heaviness and headache. The medicine is lac deploratum. And in those cases, whenever they are passing urine, they feel good, but not headache relieved by urination like Gelsemium. Another sensation is vertigo, confusion of head, spreading from occiput over whole head, pupils dilated, dim sight, and general depression from heat of sun or summer. When attempting to move, the muscles refuses to obey the will. And in Bryonia, when attempting to move, they are getting pain, they are feeling bad, so they does not want to move. But in Gelsemium, they are not in a position to move. The muscle refuses to obey the will. Giddy, confused, and lack of muscular coordination. Whenever we are moving, even whenever we are moving just our finger, it needs lot of coordination, muscular and neural coordination, and motor functioning, proper motor functioning. In Gelsemium, that is the gross lack of muscular coordination. So we are getting the symptom, patient hardly want to move, they want to lie down, but we should discriminate properly whether the patient is not willing to move out of aggravation of general complaint, or actually he could not move due to the incoordination of the motor functioning and the muscles are refusing to obey the will. Serious attacks of vertigo with dimness of vision and fever appears like one intoxicated. Especially in post-influenza cases, we may get lots of patients. Influenza is being cured with homeopathic or allopathic medicines, but after that, the vertigo was not subsided, and patient is very much depressed, not taking water, not taking food, not like to speak more. Considering all the symptoms, we may prescribe Gelsemium and it will act miraculously. Now I am presenting few particular symptoms whichever generally we are getting in our daily practice. There are lots of particular symptoms you may get in source books. Fullness in head, heat of face, chilliness, pulsation of carotids, and thick speech. Brain feel as if bruised. Eyeballs feel sore when moving them, and double vision. Heaviness of head, slightly ameliorated by shaking head, like that. And mostly ameliorated after profuse watery urine micturition. Pain in temple extending to ear and weighing of the nose, chin, headache with muscular soreness of neck and shoulders. Sometimes it may resemble with bryonia, russtox, headache preceded by blindness, and better by profuse urination. So the particular modality, headache, vertigo, even blindness with headache, amelioration after profuse urination is a grand indication for Gelsemium prescription. Sick headache, principally in the right temple, beginning in morning and increasing during day. That is also very much similar to bryonia and netamio. Aggravation from motion and light, and amelioration from lying down. That is also very similar to bryonia, and amelioration by sleep or vomiting. Neuralgic headache beginning in upper cervical spine, back part, and the vertebra prominence is very much sensitive, especially C4, C5. If we can palpate it, patient will get pain, and pain extend overhead, causing a bursting pain in forehead and eyeballs, especially aggravation at 10 a.m. when lying with nausea, vomit, cold sweat, and cold feet. In those cases also, we may confuse with netamur, we may confuse with tabacum, with Gelsemium. Now, eye symptoms, the very important and characteristics eye symptom we are getting in Gelsemium patient, diplopia. Actually, vision, whenever we are seeing anything, is a very composite and integrate function of eyeball up to the optic nerve. But diplopia, whatever we are getting in Gelsemium, it is not actually related with brain pathology, but the muscles which is responsible for movement of eyeball and fixation of picture in retina, all those things, the paralysis of oculomotor and abducens muscles causing diplopia. C is double. When inclining head towards shoulder, like that. Like that, if anyone like to see anything, sit double. Like sideways, whenever just looking straight forward, hardly they are getting diplopia. Whenever just moving head like that, they may get diplopia. Double vision controllable by strength of will. That is very important. Whenever patient is suffering or getting annoyed, having diplopia, if within time he consented, no, actually it is not two, it is one. And when repeatedly he hears this thing in his mind, just strength of will is sufficient to correct the phenomena for that time particularly. Diplopia is spasm of various muscles throughout body and without thirst. Another important symptom we are getting in Gelsemium, generally the patient, those who are suffering from severe myopia, they are having a tendency of detachment of retina. The Gelsemium patient, those who are suffering from myopia and detachment of retina with severe attacks of neuralgic pain, great heaviness of lids, difficulty to opening and keeping it open like that, dim-sighted, pupils dilated and insensible to light. If we observe with a torch light and observe the light reflex of Gelsemium patient, The pupil will be dilated and insensible to light. Orbital neuralgia with contraction and twitching of the muscles. In this slide, actually demonstrating the drooping of eyelids. You may see the thing, the drooping of eyelids. Eyelids heavy, eyes closed when looking steadily. And in the left side, you are getting the responsible muscles, which helps open the eye. Now I am happy to share the comparative comparison of Gelsemium with other medicine. Regarding Ptosis, there are another 4 to 5 beautiful medicine we are having in Homoeopathic Medica: Rastox, Calmia, Sepia, and Alumina. Ptosis with difficult speech and red suffused face. The medicine is Gelsemium. Ptosis in rheumatic subject with history of weight exposure. Rastox. Ptosis in rheumatic subject with stiffness of lids. Calmia. Ptosis in rheumatic subject with involuntary lacrimation and history of not wet exposure, dry cold exposure. The medicine is causticum. Ptosis with menstrual irregularities. Sepia. Ptosis with constipation, especially no desire for stool. The medicine is alumina. So just observing ptosis, we are not supposed to prescribe Gelsemium straightway. We should consider the causation, we should consider the phenomenology of the patient. Now face, hot, heavy, flushed, besotted looking. In short, we may narrate like a toxic look. Neuralgia of face, dusky, heavy face with vertigo and dim vision. Facial muscles may be contracted, especially around the mouth. Chin quivers, lower jaw may be dropped. Now mouth, putrid taste and breath, especially in typhoid. In fever, patients are presenting with this symptom, putrid taste and breath. Tongue is numb, thick, coated, yellowish, tremble and paralyzed. Thick tongue, this symptom mostly manifested with difficulty in speaking. Muscle of face, especially around mouth, seems contracted. Constant burning, stinging sensation in the mouth. Stiffness of the jaw, difficulty in opening. Trismus. In conventional medicine, trismus is almost incurable. Toothache from a cold or purely neuralgic, pain from teeth to temple. Now, respiratory system, upper respiratory, sneezing, fullness at root of the nose, pain at root of the nose with sneezing is characteristics for our side. Fullness at root of the nose with sneezing is characteristics of Gelsemium. Dryness of nasal fauci, swelling of turbinates, watery excoriating discharge, acute coryza with dull headache resulting into fever, catarrhal deafness with pain from throat into middle ear. Patient is suffering from acute catarrhal stage with blockage of ear. After influenza or after catarrhal fever, when fever subsided, all symptoms subsided, only the deafness is present, Rastox would be a very good medicine for selection of remedy. Then difficult swallowing, especially warm food. Sneezing with difficult swallowing, especially of cold food or cold drinks, that is Sabadilla. Itching and tickling in soft palate and nasopharynx, continuous irritation comes. Post-diphtheritic paralysis, tonsillitis, shooting pain into ears, feeling of a lump in the throat that cannot be swallowed. Another important symptom we should keep in mind, both in coryza, both in fever, acute aphonia. Swallowing causes pain in the ear, difficult swallowing. hypersalve, nagdhamika, phytolaka, pain from throat to ear, if it is the right side, and burning pain in throat, phytolaka is a very good choice. Aphonia and short throat during menses. Now lower, slowness of breathing with great prostration. As we are getting lower respiratory tract symptom in antimptot, in spongia, in hypersalve, the congestion and inflammatory changes in lungs, hardly we are getting in Gelsemium. There is slowness of breathing, but with prostration is hallmark. There is sense of oppression in chest, dry cough, short chest. The upper respiratory tract is mostly influenced and involved. Spasm of the glottis, aphonia, acute bronchitis, respiration hurried, spasmodic affection of lungs and diaphragm. Now I am sharing the manifestation in female genitalia, especially during pregnancy. If anyone is suffering from dimness of vision, double vision, Gelsemium not only cured that particular symptom, at the same time, it will in advance cure the apprehension before labor with Gelsemium. Sensation like a wave from uterus to throat, ending with a choking feeling. This seems to impede labor, impending spasm. False labor like pain, pains pass up back. Nervous chills, chatters in first stage of labor. Threatened abortion from sudden depressing emotions. Getting sudden bad news, patient may suffer from abortion. Dysmenorrhea with scanty flow, menses retarded, pain extending from back to hips. Female genitalia symptom accompanied with heaviness of the head and mental confused state. Aphonia and short throat during menses. Short throat before and during menses is a very important symptom of calcarea carb too. Now, male genitalia, spermatoria without erection, emission even during stool, genitals cold and relaxed. Another important symptoms generally patient will tell, that is the continuous sweating on the scrotum. Seminal emission from excessive irritation of organs of generation, either from emotion or local congestive causes. Atonic seminal emission. Relaxed organ with dreams they following the emission. Weakness feels in the knees. It is also very similar with another medicine, that is diascoria. Caladium, we are also getting seminal emission without any lasciviousness. Gelsemium is a very good medicine for psychological importance, that is, those who are newly married and very much nervous before the act, but actually they are not important. In those cases, caladium, gelsemium will help a lot. Then the heart, a feeling as if it were necessary to keep in motion, or else heart section would be seized. Generally, we do not feel the physiological function of cardiac muscles, but the inactivity, inaction, and incoordination of muscles in Gelsemium is so marked. Patient subjectively feels the incoordination of cardiac muscles, and so there is an apprehension. You have to keep in motion, or else heart section will be seized. Palpitation, pulse soft, weak, full and flowing. Pulse slow when quiet, but greatly accelerated on motion. That is very natural. Weak, slow pulse of old age. Now back and extremities. Dull, heavy pain with relaxation of the whole muscular system. Bruised, fatigue. Pain in neck, upper sternocleidomastoid muscles. Dull aching throughout the spine, especially lumbar and sacral region. Cramp in muscles of forearm also. Writer's cramp. Excessive trembling and weakness of all limbs, hysterical convulsions. Obstinate sciatica, pain aggravates at rest and particularly when beginning to work. This is very much similar to Rastox. and burning pains aggravate at night and compelling heart to lie awake. Now fever, generally we are prescribing Gelsemium in fever. In actually homeopathic physicians throughout their life, they mostly prescribe Gelsemium for fever, to avoid fever. Who wants to be held because he shakes so. Chattering, chilliness is so much. Pulse slow, full, soft, comprehensive, compressible. Chilliness up and down along the course of the spine. Heat and sweat stage, long and exhausting. Chilliness followed by heat, followed by sweat stage. Sweat stage that is very long and exhausting. Damp ague with muscular soreness, great prostration and violent headache. Prostration like arsenic, violent headache like belladonna, and general depression of Gelsemium. All those things we may get in Gelsemium fever. Nervous chills with stupor, dizziness, faintness, thirstlessness, and prostrated. Chill without thirst along the spine, wave-like sensation from sacrum to occiput, occiput to sacrum. Hot, dry, itching, measles-like eruption. Catarrhal symptom aids in bringing out the eruption. In children, sometimes it may happen, the low grade of fever, and they took few antipyretic medicines from our fellow colleagues, allopathic fellow colleagues, and the measles eruption could not erupt properly. In those cases, appreciating the symptoms, if we prescribe Gelsemium in correct potency and dose, it will help to bring out the eruption. Now I am presenting the mnemonic 10D for Gelsemium. Left side there is 5, in right side there is 5. All words started with D. In mental, dullness, dizziness, drowsiness, dread, and depressing emotion. In physical level, shuddering, drooping of eyelids, dimness of vision, diplopia, and depressed. Now, if we would like to summarize the genius of Gelsemium, out of which we prescribe Gelsemium safely and it will help the patient beautifully. That is dullness, dizziness, dust, and dimness. Dread, nervous, dread of death, lack of courage. Depression of vitality, not only in mental depression actually. Depression of vitality, general weakness, tendency to lie down, easily fatigued. All vital functions are being compromised onward. Relaxation leads to paralytic weakness and lack of muscular coordination. Heaviness in general, heaviness in particular in eye or head like that, and rigidness. Now I am happy to share a beautiful case of Myasthenia gravis. The patient was treated during COVID period. She is staying at Delhi. Total case taking was done on telemedicine platform, virtual platform. She was a known case of Myasthenia gravis, diagnosed case, could not speak properly in post-thymectomy status. Generally, conventional medicine, they believe it is the hyperactivity of thymus gland that may lead to Myasthenia gravis. So the thymus gland, which is supposed to be rudimentary in adult age, it became enlarged and they cut it down to minimize the trouble. But despite of cutting down, it was not minimized. Complaint aggravates while in anxiety or apprehension, trembling of hands on being anxious, always feeling sad. It is the OPD ticket. Perhaps you are getting the Myasthenia gravis. Now see the case. What was the actual complaint we are getting? Already I have told. It is the symptom written in Materia Medica. Aphonia, patient may able to whisper, but he can scarcely utter any clear sound. Aphonia from depression. Just I am running the video. You just get it very minutely what she like to tell you. She was trying her level best to say something, but it appears like whispering. Can't we utter any clear sound? It was the actual symptom we get on video consultation.
What do you find from the plants and
After homeopathic treatment, you just see the improvement.
animals listed in activity? Did you find a large variety in them? Look at what you have
Now she
entered in
could
the column
speak
for
out
the
very
desert and
clearly
the column for the
whatever
sea in
she
Telugu.
likes to speak.
Did you list very different kind of order? What do you find from the plants and animals listed?
The prescription was Gelsemium 200, and it was only 2 medicated globules number 15. 2 doses was prescribed, followed by placebo. It was the first video in October 2020. It was on December 2020, after 2 months only.
Did you find a large variety in them?
It is the original
Look at
prescription
what you have
sent by
entered
courier
in
to
the
the
column
patient
for the
with the
desert
medicine.
and the column.
And considering all those symptoms we have put it in repertorial sheet, you just see, apart from desire for egg, everything we get in Gelsemium and Calcarea in both the medicines. But regarding manifestation, regarding cohesion, regarding accuracy of similarity, Gelsemium was most similar, and we prescribed Gelsemium. And afterwards, considering the new symptom and considering the new totality, we have to prescribe Calcarea Curve 200 once again. And Calcarea Curve is a very good antipsoric drug too, and it helps and recovers the remnant of the disease, rather the miasmatic cleavage of the disease. Thank all of you for your patient sharing. Once again, I pay my thanks and gratitude to the organizer, especially the principal sir and Professor Dr. Akhilesh Khan sir for giving me the opportunity to share my experiences before the learned homeopathic fraternity of our nation. It's my pleasure. Hope all the best of all of you. Especially, I convey my best wishes and love to the students and practitioners of Antarbharti College, and my respect to the director and my pranam also to him and the principal sir. Thank all of you. Namaskar.
Yes, thank you, sir, very much for such an excellent speech. Our students and we all have gained quite a lot innovative knowledge from you. Now I invite Dr. Trupti Chaudhary ma'am, the Associate Professor of Anatomy from a college AHMC, to give a nice word of thanks. Yes, Dr. Trupti ma'am.
Thanks, respected Dr. Biswajit Basu sir, for such a nice say. It was excellent. The topic was very interesting. The lecture was very fruitful and innovative. Nearing 80 participant has taken guidance today. Our students from Antarbharti Homoeopathic Medical College have joined all together and they have enlightened their knowledge. I thanks our respected director, Dr. Bhausaheb Jite, for everything. I also thanks our respected principal sir for Dr. Prashant Barbat sir for arranging such a nice upgrading events. I thanks respected Dr. Akhilesh Khan sir for sharing his knowledge with us and always enlightening us. I thanks for Banore ma'am for inaugurating this webinar with a pious events. I once again thanks to all my students, my colleagues for patiently attending this innovative great webinar. I thanks my friend Dr. Zehra ma'am for marvelously anchoring this event. Thank you very much.
Thanks, Dr. Trupti, for a very nice vote of thanks. Now I want to share that on the incoming days, we will be having more such fruitful events. So tomorrow, on 28th, Dr. Akhilesh Khan sir will be enlightening us. Time will be from 11 to 12 noon. Then Dr. Naveen Singh will be enlightening us on 29th. Then Dr. Parth Roy sir will be enlightening us on 30th. The time for Dr. Parth Roy sir will be 3 to 4 noon. And myself, Dr. Zehra Haq, I will be giving you some guidance on 29th. So please note these dates and timings and be present on all the webinars to enlighten your knowledge. Thank you.
Thank you.